I organized my studies using the Johns Hopkins Appendix G individual evidence summary tool. I had 4 studies, and the evidence level for 3 of the studies were level 1, and 1 study was a level 4, all good qualities. For that, I used the Pollock and Beck textbook for evidence level, and I used the JBI checklist to check the quality of the studies. My first article was a systematic review with meta-analysis. It had 8 studies and 10,655 patients who were pre-op patients. According to this study, evidence did not support preoperative bathing with chlorhexidine as a means of reducing surgical site infections. The observable measure was the number of surgical site infections. One of the limitations of this study was the lack of registry of other potential prognostic factors such as comorbidities and other uncontrolled conditions probably related to the risk of infection, such as the use of a prophylactic antibiotic, the removal of hair, surgical time, and a patient's age. My second article was a cohort study. It composed of 355 pre-op patients. It showed an overall reduction of infection in a group that received chlorhexidine cloth bath before surgery. There was also suggested reduction in post-op organ space infection. The main limitation for this study was the study size, but the good thing about it was very thorough and it was conducted in a hospital. My third article comprised of a systematic review, which had 20 studies, 9,520 patients who were pre-op patients. It concluded that preoperative antiseptic showers reduce bacterial colonization and may be effective at preventing surgical site infections, but it was not conclusive. The limitation was that chlorhexidine was primarily used as an antiseptic with varying showering regimens and compliance rates. The last study was a meta-analysis. It compared 4 studies with 8,787 patients who were pre-op knee surgery patients. The findings were that the preoperative use of chlorhexidine could reduce the total incidences of infection and incidences of infection in moderate risk and high risk category patients, but there was no evidence that it did the same for low risk patients. The main limitation was the follow-up period was relatively short in the included studies, and for the study it said that there was a limited number of studies, although it seems like it was quite a lot of patients who were studied.